Welcome back to the Future in Review podcast. Future in Review is an annual summit of leaders using technology to solve global challenges. And our 2024 conference is coming up October 20th to 23rd in LA at the gorgeous Terranea Resort. So one thing that we do every year at FIRE is we select a class of fire starter companies. These are companies that are using technology to change the world for the better in some way. And I am super excited to be here today with the president of one of those companies, Harold Walder, who is the president of Immunolite. Harold, welcome to the Future in Review podcast.
Thank you. It's great to be here.
It's awesome to have you here. I like to, check in about these are virtual podcasts. Clearly, we're not in the same room. So it's fun to, I'm sitting in Seattle in my office. Where are you today?
I am, actually, I live on a boat. So I am at a marina in the southeast corner of North Carolina.
Awesome. It's fun. It's good to have a little, mental map of where we all are with this internet world we live in.
Yes.
So we are so excited about Immunolite, and we're so excited that you guys are going to be joining us at FIRE this year. The technology that you have developed is really, truly revolutionary. I've talked to many people since learning about you all who wish that you would have existed earlier. Which for reasons that will become clear very shortly. But I'm wondering if you can start off by just giving us a quick overview. What is the problem that Immunolite is solving?
So, great question. We're harnessing, I'd say, the power of light to create what we believe is going to be a paradigm shift in the treatment of cancer. So 50 years ago, if you got cancer, you really had three alternatives. There was chemotherapy, radiation therapy, and surgery. Now, here we are today, albeit with great advances in all of those and the introduction of immune-based therapies.
Right.
We still have a very substantial societal problem with cancer. It's devastating emotionally. It's devastating clinically. It's devastating, financially. It's a scary, scary place to be. So we sought to find a way to do that. To find a way to change the way your body sees cancer and let it kill it like it does so many things every day.
So when you're looking at cancer, are you looking at specific types of cancer, specific types of tumors?
No, we've tried treating numerous cancers in vitro, and found activity against virtually all of them. So the one thing that cancer has in common is this uncontrolled division, this growth that just doesn't stop. We believe that the faster a cancer grows, meaning the faster it divides, the better our system will work, because it does block the division of cells, makes your body see them as foreign, and mount an immune response against it.
So I want to talk a little bit about, before we get into exactly what Immunolite is doing, I want to talk a little bit about chemo and radiation, right? Because these are the kind of, in addition to immunotherapy, which is a relatively new entrant to the treatment field, those are the two treatments that most people have relied on most heavily, I would say. Correct. In combination with, usually there's a surgery in combination with one or both of those treatments, correct?
That's very common, yes.
And a lot of the negatives, I mean, as anyone who has a family member or who has been through this themselves know, what is it like to go through chemo and radiation? How does it affect you? It's very intense. Can you tell us a little bit more about that?
It can be devastating. So chemo is generally a non-specific poison that destroys cells that are dividing. And that's why people have hair that falls out and sores down their esophagus. These are tissues that divide a lot, and chemo kills them. So it's the good news is it's become the standard of care for decades, but it's a pretty horrific experience.
And it's general. I think this is an important thing. One of the a lot of people go through cancer treatment. One of the things I don't think is talked about enough about the cancer treatments that we have relied on for so long is that they're not very targeted, right? This is why immunotherapy is such a new and exciting development. So let's talk about Immunolite. What is different about what Immunolite is doing?
So we are not targeting a specific cell. The drug we're using actually literally goes back centuries. Its first use was recorded in the ancient Greek and ancient Egyptian times, where they found that if you rub this plant and went out in the sun, it was a treatment for an autoimmune disease called vitiligo. Moving into the more modern medicine of the 1950s, 1960s, it was used in a treatment called PUVA, which was a treatment where you would take this drug orally, wait a
Mm-hmm.
couple hours to get a blood level up, and you would go stand in a light box. And it was used to treat refractory psoriasis, which is a
Wow.
pretty debilitating autoimmune disease.
Wow.
In the 70s and 80s, a treatment for cancer, the first cancer treatment using this drug, was developed actually by the founder of Immunolite. So Rick Burke developed a treatment called photopheresis, where you took these cancerous white cells out of the body, added the drug, activated that drug with ultraviolet light, and
Mm-hmm.
then reinfused those cells. When you reinfused those cells back to the patient, it engendered this rather profound immune response. And now here we are today with what we think is the latest and the largest transformation of this drug, where we could actually activate it inside of a solid tumor. So the sorolin as a drug is a very curious molecule in that it's a naturally occurring botanical. You'll find it in broccoli and figs and celery.
Right. You said Sorlin, right?
Yep, sorolin. And when you eat it, nothing happens. It's just you excrete it out. However, when it sees ultraviolet light, it activates the drug and causes the drug to kill a cell, a cancerous cell, a rapidly dividing cancerous cell, in a pathway that makes your body see that and recognize it as foreign, and then your body mounts an immune response. So the whole conundrum in all these decades of use was you could never get the drug to work in a solid tumor because the light you need to activate the drug can't get through skin.
Hmm.
So what Immunolite did was we developed a way to take forms of energy that can penetrate. So our lead right now is low dose X-ray, which, as you know, goes right through your body.
Mm-hmm.
And we built these structures that we inject directly into the tumor with the drug, sorolin, and follow that injection with a low dose X-ray. So the X-ray beam gets absorbed by these particles. The particles emit ultraviolet light. The light activates the drug kills the cell. That cell death generates a systemic immune response.
Wow.
So it's in some ways it's kind of the holy grail of cancer treatment, because you don't need to treat every tumor. You just need to treat a tumor, and the immune system, which is in your whole body, will go find the disease in other places.
That's
And that's what
incredible.
we're seeing in the early studies. Yeah, it's very
Wow.
exciting. It's very exciting.
So, okay, I have so many questions for you about this technology, and I recognize that it's interesting because what you're really doing is combining two things that have been around for a long time, actually, right?
Yes,
Thorlin
correct.
is not new. Low dose
Correct.
X-ray is not new, but
Correct.
in figuring out how to combine them together, the technology that you've developed is the implementation or the implantation, essentially.
Yep.
Um, how, like, you have been working on this personally for a long time. 17 years. This is a company that was incubated inside of Johnson and Johnson. Can you tell us a little bit more about what that process was like for you? Did you start working on this when the first version of it came out?
So I started working at Johnson and Johnson with the photopheresis technology that the founder of Immunolite had just sold to J&J.
Okay.
And I came in and spent 17 years at Johnson and Johnson working on ways to activate that drug, but always outside the body. We
Mm-hmm.
never could figure out how to activate it inside of a tumor because the light wouldn't get there. The founder called me one day and said, I want you to come see me. I need to talk to you. So I drove to his house, and
This is after he'd already sold the. Was he on the team at J&J, or was he just?
he had sold us J&J. So
Yeah.
he was off on other things.
Okay.
Rick
He,
has had an avid love for science and technology. I've known him for over 30 years now, and he's an avid lover of science. Gets up in the morning trying to find a way to make a difference,
That's
like in the
awesome.
world.
Yeah.
Yeah, it's way cool. So anyway, he called me. I went to his house, and he said, "I want you to leave J&J because I want you to work on this next generation of cancer treatment, which would be for solid tumors."
Mm-hmm.
And long story long, I did, and that was in 2007. So
Okay.
now we're in our 18th year here, trying to find a way to do it. So it was challenging on a couple levels. Technically, turning an X-ray beam into ultraviolet light is not trivial, particularly with X-ray doses that won't hurt the patient. You
Right.
need to, you
This
can't
is one of
fry
my
them.
follow-up questions, so I'm glad you're bringing it up now. Yeah.
Yeah, it's so that was a big challenge, and we ran Barrett hundreds of experiments that didn't work trying to figure this out. Now everything, failure is a very important part of innovation.
Mm-hmm.
And every time we failed, we learned something. But finally, we got to a way to make light using an X-ray beam shining on these particles. So that was a big technical challenge. I think the other
And
one,
how long? I like to give people an idea of how long these things take, actually, because it can seem often when you see something come out of the, even like LLMs are an example, right? People have been working on LLMs forever, and suddenly they're a big thing. But like,
yeah,
actually, no, they've been around for a long time. So how long
yeah,
did it take you to get through that part of the innovation challenge, which is how do we activate the light?
that was several years
Okay.
of running experiments continuously. So 4, 5, 6 years, depending on when you said you're done. You're kind of never done.
Yeah.
But that was a big piece of it. And then you've got to do animal studies and rodent studies and in vitro studies and all this stuff. So it's quite a process. And unfortunately, research isn't linear. It's 2 steps forward, 8 steps back, and
Hmm.
it comes in waves. Some days you're skating on ice, and some days you're fighting for an inch. That's just the nature of research.
Yeah. Nature
So
of entrepreneurship, also, it turns out.
yes,
Yeah.
yes, I
Yeah.
agree. Yeah, totally. Yeah, totally. The other big piece that was not technical, but a challenge was the human dynamic. So I did in my time in J&J study the process of innovation, breakthrough innovation. It's fascinating, actually. And there's a great writing by Medici Effect, it's called. And it's about the breakthrough innovation does not happen within a single area of study. It
Hmm.
happens at the intersection of multiple disciplines.
Right. Yeah.
And what we realized early on was this was not a chemistry problem. This was not a physics problem. Solving this took, chemistry and biologists and radiation physicists and oncologists and engineers all working together. And we put together an incredible and multidisciplinary team. Managing that team is a challenge. It's a little bit like herding cats.
Hmm.
It's just there's egos involved, there's
Yeah.
conflict involved. So working through that process was at times quite challenging. The good news is everyone believes in the same cause. We're all here for the same reason. Let's change the way cancer is treated, and we did. Yeah,
It's amazing what you've done, and it's also very interesting to me to hear that description of innovation being created through cross-disciplinary
totally.
aspects, because that is so much of what we do at Future in Review, right? Like we are often we talk to people about the conference all the time, and
Yeah,
some of them are like, well, I don't know, like I'm in the green building field, and it just feels like there's not enough green building people at this
yeah,
conference,
yeah, yeah.
and we're like, yeah, that's the point. What happens when you bring together people from all of these different disciplines and put them all in the same room when they're, got all these geniuses hanging out together for 4 days is new stuff happens. Like you're
Yeah,
not going to get the same old, same old, same old. You're going to get
yep,
the inspiration from another field. You're going to get a different way of thinking about a problem from someone else. And it's
yes.
just like the things that can emerge from that are really spectacular. So I really appreciate that, how you brought that to your work.
Yeah, I think it's actually one of the keys to our success is this interdisciplinary nature of what we did.
So, okay, so you've been working on this for a very long time. in the world of business and tech, right?
Yes.
17
Yes.
years is how did you decide that it was time to bring this technology out into the light? Pardon my pun.
Wow. Well, cancer is a big problem, right?
Yeah.
And
Hmm.
and I give the founder most of this credit because he's the one that said, "I think I found a way to treat solid tumors." That
Hmm.
Sorlin is known forever. Its properties are well known. One of the reasons we're so bullish on this technology is it's got a 60 or 70-year history of being safe and effective,
Right.
albeit in other areas.
Right.
But unlike a new chemical entity, we know what happens when you activate this drug. So um, it was more of a process than an event. I mean, I got called in to set up this company and run it. With one thing in mind, and that's let's make a difference in cancer. It is time. It is time.
And you were so this company. I apologize if I'm getting this incorrect, but this company was officially founded. Immunolite was founded
'07.
'07. Okay, so um, and that's still a long runway, right?
Yeah, we're in our 18th year. Yeah.
Why now, right? Like, what is it about this moment where you're like, it's ready? Where are you in the
Um,
trial process? Where are you in the?
yeah, it's ready in that we know what the drug does. We know how
Mhm.
to activate the drug. We're in clinical trials now. We've run experiments in the normal rodent stuff, the normal toxicity stuff. Everything looks good. So um, why now is, I as we push the team, we almost say, why did it take so long? This should have been done 10 years ago, not why now. Why are you this late?
But you feel like you're in clinical trials.
Correct.
If there's someone watching that is interested in, maybe they have someone in their family with a cancer that's resistant to uh, chemo or radiation, or isn't work, other methods are not working. How is there a way for them to get connected with you all?
The best way is through our website, immunolite.com. That
Okay,
really is the best way. And we've got people in the clinical team that monitor that site continuously. On
wonderful.
that site, there's a direct phone number. You can talk to someone in the clinical department, and we'll take it from there.
Okay, and how effective is it at treating tumors that are resistant to other? Like, what are the rates that you're seeing early on? Clearly, you're still in trials, but can you give me some data about success rates?
Yeah, it's a little early to talk about the patients that are evaluated. I can tell you the one thing we did that's a little unusual for a drug development company. Normally, you do your petri dish work, and then you do some rodents activity work, and then you do your dosing studies in human. We took a slightly different turn where we went after our normal rodent work. We went to treat dogs. And in cancer research, there's an old saying that rats lie because rodents don't predict responses in humans very well.
Hmm.
You look at a canine, a dog is much closer to a human in terms of the way they get cancer. So the pathways for resistance to therapy and metastatic disease, cell death, they're all very similar between human and dog. So we started some dog studies, and knowing that they would much quicker translate to humans.
Hmm.
So in those studies, which I can report on, if we look at clinical improvement, which clinicians would define as your disease is stable, it was
Hmm.
progressing, it's now stable, or smaller, or completely gone, we have about a 70% success rate.
And how does that compare to existing therapies?
That's much higher than existing therapies. Yeah, you can get FDA approval on
Hmm.
20, 25, 30% improvements. I mean, it's I've seen drugs get approved where they prolong survival by 10 or 12 weeks. And no,
Right.
that 10 or 12 weeks is not very fun. It's with
Yeah,
all the horrors of chemo. So we're pretty excited about what we're seeing.
that's awesome. I'm very excited about this as well. Okay, so let's talk about kind of next steps. So you'll be at Fire,
Yes.
and you've mentioned to me that there are also, we're looking at cancer now. there are also some other applications of Immunolights technology. Can you tell us a little bit more about what that might be?
Sure. So, at the core of what we've done, we take one form of energy and turn it into another.
Mm-hmm.
And in this lead application, we're
And this is the X-ray.
turning X-ray into light to
Yeah.
activate a drug.
Mm-hmm.
So if we talk about adhesives for a minute, a lot of adhesives are cured by heat. But in this world of micro miniaturization of electronics, parts are getting smaller and smaller and thinner and thinner. And when you use heat to cure pieces that are glued together, the
Right.
heat can cause stress cracks or warping. So it doesn't work well in some of these applications. We take these energy converting particles and we put them right in the glue.
Mm-hmm.
And then you can shine an X-ray beam on that adhesive bead. The same thing happens. These particles absorb X-ray, they emit light, and the light cures a UV curable adhesive. So now you've got something that is room temperature, no heat involved, and you don't need a direct line of sight like you do with current UV adhesives. So currently with a UV adhesive, you lay down your adhesive bead and you shine a light on it and it binds it. Now you can have a part buried in the middle of an assembly, put the glue in, put the assembly together, shine X-ray on it, and it'll bond inside the assembly. So that's one.
Is this primarily for like electronics manufacturing?
That seems to be where
like
the
you're
most
talking about circuit boards and.
Yeah, we are. We're working with one of the largest consumer electronics companies now on a problem they're trying to solve with exactly that. They've got a tiny little part in the middle of an assembly. There's no line of sight to glue. They can't heat it. So it's perfect for that applications like that. Yes. Yes.
Awesome. Okay.
And also in the world of solar, about half of the sunlight that hits the earth is not converted by current solar panels. They just can't see those wavelengths of energy.
Mm-hmm.
So we developed some ways to actually capture more of the sunlight that hits the earth and make a solar panel see that. So the expectation would be we can dramatically innovate the efficiency by which solar cells work.
Awesome.
Which is, that'd be awesome. And then the last one, which is maybe the biggest and maybe the most fun, is what we call the generation of color. So everything you see is color. That's what your eyes see. So if you have, your red car in the parking lot, it looks red because all of the other colors are absorbed and red is the only one reflected. Well, we can take all those other colors that would be absorbed into a surface and turn them into another color, like red. So we could have super vibrant hues and chromas that affects everything. It would be paints and pigments and clothing and cosmetics and hair care and skin care. The list goes on and on. In addition,
okay, wait, hold on before you just glaze over that.
Yeah.
What does that mean in reality? It's just like super vibrant color?
Yeah, you can get super vibrant colors, color effects. You can change if you put them in like skin creams. You can change the hue of your skin based on
amazing Halloween costumes.
You probably could, yeah.
Neon vehicles.
Yeah. Another big application is we can actually make color inside of like fibers, or even entire sheets of material. So this is potentially a very substantial differentiation point for apparel, where you could actually have, as an example, a shoe that the logo lights up, or if kids are using it in a soccer field when a score is made, the team's shirts light up. The possibilities are endless. And we are actually validating this now in the sports apparel industry.
So I'm sorry, I'm trying to understand this as you're explaining it to me. How is it that the glue has been activated already and then it's able to reactivate as things like
no, this is completely independent.
What is going on here?
So now you would have so forget about the glue, although you can obviously glue parts together. But now with color generation, we have technologies that we've developed and patented that actually have the ability to modify any incident color that you would see into something else. So you
Wow.
could get special effects. You could get, as you run, your shoe could change color as you run faster. It's just
Without any
because,
kind of connectivity.
correct, correct.
Sounds like Joseph's Amazing Technicolor Dreamcoat.
it's,
No
it's,
batteries required.
yeah, yeah. And we have applications that are passive, meaning there's no power required. It's inherent in the material itself. And we
Hmm.
have other applications where you would have like a small watch battery or something
Hmm.
buried somewhere in a garment or a, footwear or something like that. But it's exciting, and that one I think the possibilities are they're endless. They really are.
It's really fun. I mean, this is kind of my favorite type of problem to think about. Because you're like, what could we do with that? That would be so fun.
Yeah, yeah, yeah. And it's the focus of this company has been all about cancer. It's why we get
Mhm.
up in the morning. It's what we're passionate about. But these other areas are not only interesting, but I think they're quite valuable.
Definitely.
Yeah,
They'll have to be, we'll come back to those as future fire starter companies once they've spun out into their own, into their own
indeed.
segments.
Yes, indeed.
So I have one last question for you. This has been an awesome conversation. I'm very much looking forward to talking more about this in LA. When you look at the future powered by Immunolight, what does it look like? What is your vision of the world with Immunolight in it?
Wow. So imagine a world where cancer is no longer a devastating disease. The societal impact of arguably one of the worst human conditions you could have is mitigated or even gone. That's what's out there for us. Imagine a world where solar energy now is ubiquitous because it's so energy efficient. That companies can differentiate their products from their competitors with really novel looking aspects to what they sell. The future is going to be amazing.
Is okay, I'm just trying to make sure that people understand, I think, how. So describe the Immunolight treatment process to your best
Sure.
guess. So I have cancer. I'm diagnosed with cancer. I go in. How long does it take? What's the treatment like? How?
So the treatment is we have this vial of powder, the energy
Mhm.
converters, a vial of drug. We mix them
Mhm.
together, put them in a syringe, directly inject it into the tumor. Then
Mhm.
you get a short X-ray. That
Okay.
process takes about, by the time you get undressed and redressed, 20 to 30 minutes.
Okay.
And we currently treat 4 times over 8 days. So you'd come in like a Monday, Wednesday, Friday, Monday. Virtually no side effects. And we typically give a one treatment booster 4 to 6 weeks later. And that's it.
That sounds pretty good, Harold.
Yeah, it's great. It's great.
I think everyone who's watching this podcast can see why that Immunolight has been selected as a fire starter this year. And we are very excited about the future of the world with your product in it. Um,
We're honored, and we're
yeah.
excited to share.
Thank you so much for your time today. It's been great talking with you.
Thank you so much. Bye bye.